Using Integrated Outbreak Analytics, or IOA, to understand cholera risk, prevention, and transmission. Outbreaks can be explored using IOA, or Integrated Outbreak Analytics, which utilizes different information sources and expertise. Cholera outbreaks are known to be associated with poor water, sanitation, and hygiene, or WASH. However, local context may also influence cholera risk and transmission dynamics. The IOA initiative makes 5 recommendations to understand cholera outbreaks. Number 1. Existing data should be used to support early warning, alert, and response. For example, regular monitoring of water quality or diarrheal diseases can identify potential cholera risk. This information can be collected from health information systems, water committees, or a WASH cluster. Risk factors that are associated with increased incidence or severity of cholera, such as malnutrition, should also be monitored to improve the response. Data from health information systems, community-based surveillance, or healthcare worker interviews can provide this information. Number 2. Community source data should be integrated into the analysis. Many communities have experienced cholera outbreaks before and know how to prevent it, but practically this may be challenging. For example, access to safe water, chlorine, or soap may be limited due to physical, social, and financial barriers. Information on these barriers can help to identify high-risk groups and ensure appropriate response activities. In addition, community source data such as trust and prior use of healthcare services, health information available to communities, and the factors that drive the decision to seek healthcare can help explain disease trends. Such information can be collected via surveys, focus groups, or case investigation reports. Number 3. While data on the sex and age of cases tells us who is most affected, it is important to understand how gender dynamics influence prevention and risk of infection. For example, in a province in the Democratic Republic of Congo, primary attack rates in men were higher than in women. However, secondary attack rates were higher in women. This was likely due to men becoming infected while fishing at the lake and infecting their families when returning to their villages. Cholera and gender-based violence should be considered together. Accessing safe water and latrines may place women at increased risk of such violence. Women may therefore prefer to increase their risk of cholera rather than access safe water points or latrines. Information on gender dynamics can be collected via surveys, case investigation reports, and qualitative interviews. Number 4. The broader impacts of cholera and its response on communities and community health should be monitored. While healthcare workers are mobilized to respond to cholera outbreaks, routine healthcare services like maternal and child health can be disrupted. Actions must be taken to ensure continuity of these essential services. Healthcare services use can be monitored through health information systems data or direct collection of registry data. Number 5. Local events that can influence disease outbreaks should be monitored. These may be environmental, such as natural disasters, conflict-associated, such as displaced populations, or even response-associated, such as the introduction of free healthcare or safe water trucking. Integrating the analyses of these different information sources can help us understand the bigger picture and identify optimal response activities for the local context. To find out more about IOA, please select one of these videos.